Our aim and our ambition is to actually help people. That's what our job is.
The longer that people are out of work, the worse their health becomes.
To be well and to be fit again has made a massive improvement to my life.
We're working at a very much grassroots level with the Primary Care Trust and the Health Service on this.
When they see what we can offer, they're quite good at taking things up.
Confidence is better, your self-esteem is better.
You can get back up. I did it, and I'm sure other people can as well.
Now we've actually got this new service where I say, hang on a sec, got an idea.
Working is good for your health. It can concentrate the mind and keep the body active. Not to mention the enormous benefits of a daily routine, the company of colleagues, and of course the paycheck at the end of the day. But for many people in Barrow, being unwell has significantly reduced the chances of getting and keeping a job. And here in Barrow, this problem is the worst in Cumbria. More than 13% of people of working age are claiming incapacity benefit. That's almost twice the national average. And just as working is good for you, not working is positively harmful to your health. It's something Mike Graham knows only too well. He spent 26 years building a career in the shipyard before ill health meant long-term sickness and eventually the loss of his job.
In that period where I wasn't working, which was for about 12 months, I was at a very, very low ebb. I've never experienced that lowness before. And in fact, at the time, I was told I could go even lower, and I did. I just didn't know where I was going to go.
Thankfully, help was at hand in the form of the Return to Work project offered by the Barrow company, Furness Enterprise. Mike was offered help and advice, funding, and the initial contact with an employer who offered him a job. Now, NHS Cumbria is hoping to build on that kind of good work in Barrow, with a new project bringing together health professionals and Job Centre Plus. Under this scheme, employment advisors are being invited right into doctors' surgeries. For the GPs taking part, it's a great way to connect patients who may be off sick with very practical help.
In general practice, what do? We see a patient, we assess them, and then we post them out of the room with something, such as a prescription, a test, a referral. And that's fine when you've got a physical or a mental health problem that needs that approach. But when you've got somebody who's unemployed, you can't give them a prescription, you can't do a test for them, you can't refer them anywhere historically. But now we've actually got this new service where I can say, hang on a sec, got an idea, I'm going to send you to this lady for an assessment and support. So it's another option. And I think having it in the surgery makes it a less intimidating option for the patient. It's got our support.
6 GP surgeries in Barrow are taking part in the initiative to bring health and employment agencies closer together.
It's broken down a lot of barriers in the past because Job Centre at Grassroots has not traditionally worked with GPs, and this is a fantastic opportunity for that barrier to come down and for us to actually work in partnership with GPs.
Hello.
Hello, it's Elaine, the employment advisor. Do you know what room I'm in today?
Yes, you'll be in the treatment room. You're already logged onto the computer system, so just go ahead, that's where it's.
Thank you very much, thanks.
Welcome.
It was slow at first, but now people are getting used to me being around. More and more people are coming to see me. And those people that I do see are looking towards going back to work and help with the quality of their life, which in turn will help them move towards work at the end of the day.
With the Pathways approach, advisors like Elaine can offer a wide range of services. Ultimately, they can help people find employment through return to work programmes. But as well as that, there's advice on training courses, leisure programmes and calculations to make the most of benefits. In addition, they can arrange access to health professionals, to voluntary and charitable organisations. All this can start the process of getting people back to work.
One of our major concerns in Cumbria is with health inequalities, and this relationship between health and work is an important factor that contributes to that. People in more disadvantaged areas are more likely to have problems with their health, and that means that they're also more likely to have problems with their employment when they have health problems. So what this is about is about trying to break that relationship between poor health and loss of work, and that's something that we can do locally to really have an effect on health inequalities.
Darren Snow was out of work for 6 years before he too found employment through the Furness Enterprise Scheme. He's in no doubt about the benefits.
I feel good when I get up because I've got something to come and do. I feel good when I go home because I'm tired. I'm not constantly, even though, like, my wife and my 2 children, even though that, you know, love them to bits, like, we're always together sort of thing, and it's not, I can't go home and talk about work because I haven't been working and things. Or when I'm at the pub with the lads, like, what do you do at work? So it's just great because confidence is better, your self-esteem's better, you've got something every day that's different, and you feel tired. Just everything, really. I think it's great. I wouldn't change it. It's the best thing I ever did.
NHS Cumbria now hope that its new project can add to the good work already being done in Barrow. The aim is to reduce the number of people claiming benefits by getting them back on the road to employment. Like Darren, Mike Graham's found his feet again and says that with help, the downward spiral of worklessness can come to an end.
I don't need medication, I don't need tablets, fitness is a big issue, and my confidence is back. And to these people who have been out of work, of course, you get depressed, you get low, you get down, you see no light at the end of the tunnel, and you are in a loop. You feel like you're not going to go anywhere. But if you can dig deep and take the offering help and support that's there, and really you can get back up. I did it, and I'm sure other people can as well.